Check your medicine cabinet right now. Maybe you have ibuprofen, antiseptic cream, bandages. You grabbed them at a pharmacy without thinking, probably spent less than $15 on all of it. But for hundreds of thousands of years, every single one of your ancestors faced the same infections, the same broken bones, the same traumatic wounds, with none of it. Just their hands, stone tools, and a knowledge of the human body so precise it should be impossible given everything else they didn't have. So how did they not just treat injuries but perform surgery so sophisticated that modern doctors are still unpacking how they worked? The answer is not what you think, and it will permanently change how you look at the tools sitting in your medicine cabinet right now. Let's start with what the injuries actually look like. We're talking about a world without antibiotics, without sterile operating rooms, without blood transfusions. A deep cut in that environment doesn't just hurt, it becomes a death sentence within days as infection sets in. A broken bone that heals wrong means permanent disability, which, in a world requiring constant physical activity, means eventual starvation. A head injury means pressure building inside the skull with no way to relieve it. The popular image is always the same: ancient humans dying helplessly from wounds modern medicine would treat in 20 minutes. But archaeology tells a completely different story. A story of surgeons. Here's the first thing archaeology got wrong about your ancestors. Their cutting tools were not primitive. At the Neolithic site of Çatalhöyük in Turkey, dating back 9,000 years, researchers found surgical instruments made from obsidian, a volcanic glass that forms naturally when lava cools rapidly. When knapped correctly, obsidian produces an edge measuring 3 nanometers thick. A modern stainless steel surgical scalpel measures between 100 and 200 nanometers at its sharpest point. Your ancestors' stone blades were not cruder than modern surgical steel. They were up to 50 times sharper. Today, a small number of specialized surgeons performing delicate eye and neurosurgery still request obsidian blades for procedures where tissue trauma must be minimized to the absolute limit. The most advanced medical institutions in the world occasionally reach for a stone knife that a Neolithic surgeon would have recognized immediately. But the most dramatic evidence of ancient surgical capability wasn't found in Turkey. In 2022, a paper published in Nature reported the discovery of a skeleton in a cave in Borneo dated to at least 31,000 years ago. The lower left leg had been amputated. Not accidentally, not traumatically, surgically. The bone showed a clean, deliberate cut through the tibia and fibula with no evidence of the crushing fractures that would result from an accident or animal attack. More importantly, the bone had healed extensively, correctly, and completely, in a way that took years of survival after the operation. Whoever performed that surgery had precise anatomical knowledge of where to cut, understood how to manage blood loss in real time, knew how to close and dress the wound to prevent infection through a months-long healing process, and had access to enough pharmacological knowledge to manage pain and inflammation across that entire recovery period. The previous oldest confirmed surgical amputation had been dated to 7,000 years ago. This single discovery pushed the history of surgery back by 24,000 years. Now here is where it gets genuinely unsettling, because the next discovery came not from bones, but from teeth. At the Neolithic site of Mehrgarh in present-day Pakistan, researchers found evidence dated to 9,000 years ago of deliberate dental drilling. 11 teeth from 9 separate individuals showed precisely shaped holes drilled into the enamel using flint drill heads, following the path of decay directly into the tooth interior. The drilling was not random, it was targeted. The holes were shaped, smooth, and in some cases show evidence of medicinal material packed inside. In Slovenia, a 6,500-year-old human tooth was recovered with its cavity filled entirely with beeswax, applied while the patient was still alive based on the molecular bonding at the tooth interface. Your ancestors were performing cavity fillings 6,500 years before the first dental school opened. But none of this worked without pain management, and this is where ancient medicine becomes genuinely extraordinary. At Shanidar Cave in Iraq, A Neanderthal burial site dating back 60,000 years contained unusually high concentrations of pollen from 8 specific plant species, including ephedra, groundsel, and yarrow. All 8 have documented pharmacological properties, including anti-inflammatory, analgesic, and sedative effects. This was not a random assemblage of plants, it was a curated pharmacopoeia. Chemical analysis of residue from ancient vessels across multiple Neolithic sites has since confirmed the deliberate preparation of plant compounds with specific medical targets. These were not people who chewed random herbs hoping for the best. They were pharmacologists working from a detailed empirical knowledge of plant chemistry built across generations of systematic observation. Now here's the part that stops modern surgeons when they first encounter it. Ancient surgical tools were not just sharp, they were sterile. Not accidentally, not by luck, deliberately. Archaeological analysis of obsidian blades recovered from surgical contexts shows heating patterns consistent with flame treatment before use. Honey residue has been identified in ancient wound dressings across multiple unconnected cultures, from Egypt to South America to Southeast Asia. Honey produces hydrogen peroxide continuously through enzymatic reaction, making it one of the most effective natural antibacterial substances on Earth. Ancient surgeons did not know what bacteria were, but they knew empirically, through thousands of years of observation, exactly which materials prevented wounds from rotting and which allowed them to heal cleanly. They had arrived at sterile technique without germ theory, the way a blind person learns the layout of a building perfectly through touch, without ever having seen a floor plan. And then there is the procedure that most completely defies expectation: trepanation, the deliberate drilling of a hole through the living human skull. Trepan skulls have been found at Neolithic sites across France, Portugal, Russia, China, Peru, and North Africa, representing at least 6 independent cultural traditions that developed the procedure separately with no documented contact between them. The oldest confirmed trepan skull dates to approximately 7,000 BCE. The bone surrounding the hole shows regrowth, which means the patients survived the operation, not some of them. Across studied samples, survival rates based on bone healing evidence consistently reach between 75 and 80%. These are survival rates that would have been considered acceptable in European hospitals as recently as the early 20th century. Stone Age surgeons operating with flint tools were achieving outcomes that matched the performance of trained medical doctors working 9,000 years later. What happened after the surgery is equally revealing. At sites across the Paleolithic and Neolithic record, archaeological evidence shows post-operative care as a distinct and organized activity. Patients with healed complex fractures show bone alignment too precise to be accidental, meaning the fracture was set correctly and held in position throughout healing. Healed wounds show evidence of consistent dressing changes over time. Long-term survival after serious injury at sites far from any natural advantage demonstrates that injured individuals were being actively supported, fed, and protected by their group throughout extended recovery periods. Ancient medicine was not just technical, it was social. The community was part of the treatment. The knowledge that made all of this possible was never written down. It was encoded in apprenticeship, in ritual, in the accumulated memory of every healer who had practiced before. When European explorers arrived in the Americas, Africa, and the Pacific, they consistently documented local medical practices that modern pharmacology has since validated one compound at a time. The Amazon basin contains plant compounds now used in surgical anesthesia. Sub-Saharan African healers use preparations that modern analysis confirms as effective antibacterials. The knowledge was not lost to time. In most cases, it was dismissed, and then quietly rediscovered by Western science and repackaged as innovation. Go back to that medicine cabinet. The ibuprofen inside it is a synthetic version of the anti-inflammatory compounds found in willow bark, a preparation ancient healers used for at least 3,500 documented years before a German chemist synthesized it in a laboratory in 1897 and called it aspirin. The honey-based wound dressings now sold in pharmacies for resistant infections are a direct continuation of a technique practiced at least 5,000 years ago. The obsidian blade sitting in an archaeological museum in Ankara is sharper than the scalpel your surgeon used last time you needed stitches. The 31,000-year-old surgeon in Borneo who performed a below-knee amputation with stone tools and kept the patient alive for years afterward was working with less equipment than a modern field medic carries in a single pocket and achieved outcomes that the same field medic would consider a success today.